Hi, my name is Sarah Lane. I'm a doctoral candidate at Murray State University, and I will be completing my comprehensive physical checkoff exam today. So let's begin. Hello.
Hello.
How are you?
I'm good. How are you?
Great. My name is Sarah. I'll be your anesthesia provider today. What's your name?
My name's Nicole King, or Nikki.
Nikki? Wonderful. May I call you Nikki?
Yes.
All right. Great, Nikki. Can you tell me your date of birth?
11/19/1990.
Great. And can you tell me where we are?
Sure, at the hospital.
All right. What are you here for today, Nikki?
I'm here for just a general assessment.
The jail set, like a head-to-toe physical. Wonderful. Do you have any questions before we get started?
Nope.
All right. This may take about an hour, a little less. Do you need to use the restroom before we get started?
No, good, thank you.
Wonderful. I'll ask you a couple questions real quick. Can you tell me what year it is?
2019.
2019. And who's our president?
Trump.
Trump. And Nikki, if you were in a burning building, what would you do?
I would try to get out there as fast as I could.
Awesome. That's great, Nikki. All right. So when Nikki walked in, I noticed that her general appearance, she was kept. Her mobility, she was ambulatory independently. And she answered all her questions within reason. And she's alert and oriented times 4. So, all right. Are you ready to get started?
Sure.
All right. I'm going to start with your head. I'm going to move down to your toes. And then at the end, I'll test your cranial nerves, your musculoskeletal system, as well as your cerebellar and sensory systems. So we'll go ahead and get started, okay? All right. So perform hand hygiene and don gloves. All right, Nikki, I'm just going to feel of your head and your hair. That's okay. Wonderful. I'm just noticing or looking for any lumps, bumps, abnormalities, asymmetry, any obvious infestations, which I see none. If Nikki were a male and had a beard, I would also look at that as well. Any balding patterns, and everything appears to be within normal limits. So that is great. All right. Now doff my gloves, perform hand hygiene again. Wonderful. All right, Nikki. So I'm going to go ahead and move to your face and your eyes. I'm noticing with her eyes, her external eye looks fine. There's no obvious lesions or redness on her eyelids. Her lashes look to be within normal limits. On her inner eye, I'm noticing no drainage. Her conjunctiva is pink and moist, and her sclera is white. All right. So have you had any issues with your eyes lately? Any drainage or anything like that? No. Wonderful. All righty. So I'm going to go ahead, Nikki. If you would hold this out, 12 to 14 inches here. And if you would, go ahead and read the lowest line on there backwards for me that you can read.
HPFTL.
Great. Now if you'll cover one eye.
HPFTL.
Okay, and now the other. I'll hold it for you.
HPFTL.
Great, Nikki. Alrighty. Look. Alright, her pupils are about a 5. Alrighty. And Nikki, I'm going to go ahead and shine a light in your eye. Just a second for me. What I'm looking for is to make sure your pupils are contracting and dilating appropriately. So this way. Wonderful. They both contract. Again, equally. Alrighty. Nikki, if you would, I want you to stare at this. Look off at the wall. And now back to this without moving your head. Great. And now if you'll follow this in. Wonderful. Alrighty. So your eyes. Pupils are reactive to light, round, equal, and they are accommodating appropriately. Okay. So I'm going to go ahead and check for a red reflex. Nikki, I'm just going to shine this light in your eye if you'll look straight ahead for me. Typically we do this with the lights off. So elicit a red reflex, which I do. The absence of one may be indicative of cataracts, of which I see none, which I would expect in a 28-year-old female. So, wonderful. All right, Nikki. I get this off. Wonderful. Alrighty. I'm going to go ahead and feel of your sinuses while I'm here. Your frontal, just let me know if you're feeling any tenderness or pain. None? Mm-hmm. Okay, and your maxillary, any tenderness or pain?
No.
No. Alrighty, I'm gonna go ahead and move on to your nose. It looks symmetrical, there's no obvious deviation. Go ahead and have you close each nair and sniff through. Wonderful, it is patent. And if you will just kind of look up for me. I'm gonna look into your nose. Mucosa is pink, assessing her turbinates. Mucosa and sinuses, it looks to be within normal limits. You don't have any drainage or anything abnormal? Okay, wonderful. Alrighty. And now her ear. I'm gonna palpate her pinna. Any masses, lumps and bumps, tragus. Great, and her mastoid. No tenderness there. Wonderful. Alrighty. I'm gonna look in here. Have you had any difficulty with your ears lately? Alrighty. So, looking for the tympanic membrane. I'm pulling her pinna up and backwards. Alright, her tympanic membrane appears to be gray and shiny. No wax, her ear canal is clean. Alright, look at the other side. Great cone of light. Notice on this side as well. Canal is clean. No wax, and her tympanic membrane is also gray and shiny and appears to be intact. Take this off. Alrighty. Now, I'm going to perform hand hygiene. I'm going to go ahead and put on my gloves again, Nikki. I'm just going to look in your mouth real quick, okay? Any sore throat lately? Alrighty. So her lips appear to be not cracked, moist, pink. Just stick out your tongue for me. Let me look in your mouth. Oh, it's blue.
I had a flu drink before I came here.
Blue drink. Mm-hmm. All right, that explains that. Okay, if you would go ahead and look back and say, ah. All right, her posterior pharynx is not pink or red, and I don't see her tonsils. If you'll lift your tongue for me, look under it. Great, inside real big. And her gums look good. All righty. That's good. Okay, take off my gloves. Perform hand hygiene. Okay. Now, I'm going to... Oh! Alright, I'm going to move down to your neck, okay? Nikki, you have any questions so far? Mm-hmm. Wonderful. I'm going to go and feel for a pulse. Great. Carotid pulse is 2 plus. 2 plus. Wonderful. Just going to listen real quick. If my stethoscope had a bell, I would use that, but it does not, so I'm just going to press a little harder with the one I have. Listen for bruit, of which I hear none. Wonderful. Let me go ahead and feel over your neck, Nikki. Just kind of look up for me. Symmetrical, feeling her thyroid for any lumps, bumps, or masses, which I feel none. If you go ahead and swallow for me. Great, have you had any difficulty swallowing lately? Mm-hmm. Awesome. Alrighty. And before we go further, while I'm up here, I'm going to go ahead and test your hearing one more time. Okay. If you would, I'm going to whisper a word, and I want you to repeat it back to me, okay?
Apple. Cat.
Wonderful. Awesome. I found that to be appropriate. So, okay. I'm going to keep feeling of your neck here. Okay, I'm going to feel for your lymph nodes. Have you felt any lymph node swelling or discomfort lately? Okay. Okay. So here I'm feeling the preauricular, the postauricular, occipital, right, the submandibular, the segmental, tonsillar, superficial cervical. I'm going to move down the cervical chains, press deep. Feel any? Okay. The supraclavicular and the posterior cervical. Any discomfort, tenderness there? Okay. No lumps, bumps, or masses. Alright, and then move down to your arms. So your skin is warm, dry, intact. Turgor is good. I'm gonna feel for your cap refill here. This is just me checking capillary refill time, both less than 2. I'm gonna feel your pulses now, Nikki, if you would just. Two plus on the radial. And 2 plus on the brachial. Okay, great. Alrighty, I'm gonna go ahead and go for some lymph nodes kind of in this area, so are you ticklish?
I am.
Okay, great, even better. Alright, I'm just gonna feel lymph nodes here. Central, no lumps. Lateral, feeling any. Pectoral. Subscapular. And your infraclavicular. Alright, no lumps, bumps, or masses that I feel. Those all feel like they're normal size, they're not protruding. Alrighty, I'm gonna go ahead and kind of spin you around here if you would. That way I can take a look at your back. Alright, put your hair to this end. Awesome. Great. Okay, so I'm just gonna kind of feel of your back. I noticed when she walked in and sitting here, her AP diameter is 1 to 2. I don't notice any barrel chesting like you would see in someone maybe with COPD. Alrighty. If you would, Nikki, go ahead and take a big breath through your mouth for me. Great. One more time. I'm doing about a 3 centimeter expansion there. Alright, I'm going to feel down your spine. No obvious deviations. And the paravertebral muscles. Wonderful. I'm going to press on your back, okay? You'll feel me kind of thumping. Okay, resonant, no dullness, making sure to stay off the scapula there. Alrighty. And I'm going to go ahead and listen. You can take 10 big breaths for me, Nikki. Sure. Okay. And one more big breath. Wonderful. Alrighty. I'm going to go ahead and check for. Can you tell me if you have any tenderness here? No? No tenderness. Alright, you can turn back around. Alrighty. Before I get started, on your front, I totally forgot to get your vital signs when you got in here today, so before we forget, I'm going to go ahead and get those real quick, okay? Now that I've got your heart rate all up. Alrighty. So, take your temperature real quick. 98.6. Wonderful. You'll uncross your legs for me. Rotate this around so you can see it. Okay. And cross your legs. 108 over 62. Great. Alrighty. Check your pulse. My clock. Okay, we've got about 80, probably because I've had you turning around and performing tricks. And count respirations here, because if you don't just breathe normally. And again, look at my clock. So. Okay. You are breathing about 12 times a minute. All right. Let's move on. I'm gonna go ahead and assess your front here, your chest, and your, okay. All right. Okay. Big breaths for me. 7 more. Wonderful. Alrighty. Go ahead and if you were in a hospital gown like I would see in office or in the hospital, I'd assess her chest, make sure her skin looked good, that it was no obvious lesions or lumps, bumps, masses, bruises, anything that shouldn't be there. So, alrighty. Next thing, I'm going to go ahead and listen to your heart. I'm going to feel, let's see here. For the point of maximum impulse, it should be down here. Probably may not feel on you. The breast tissue. I would assess for any thrills, lifts, heaves, anything like that right there on that apex. And go ahead and listen to your heart if that's okay. Mm-hmm. Alrighty. Straight down to listen to my aortic valve, my pulmonic, also in the second intercostal space, on the left. Third intercostal space is going to be herbs. Fourth is going to be our tricuspid. And the fifth midclavicular space is going to be our mitral. We'll listen for a full minute, Nikki, okay? Mm-hmm. Okay, wonderful. All right, slow down a little. All right. Any questions? I'm going to go ahead and look at your belly next before we move on.
Okay.
You good? All right. If you would, lay here on this pillow. All right. Comfort here. Pull this down, put your shirt up for me. Wonderful. Alrighty. Any problems with your belly recently? Nope. No going to the bathroom, no pain that you've noticed? Alrighty. So her skin looks good and intact. I don't see any rashes, anything protruding, any obvious masses. So I'm gonna go ahead. I can't see her aorta pulsating or anything, so listen real quick on all 4 quadrants for bowel sounds. Good. Good. And good. I'm going to go ahead and listen to her aortic artery for bruit, which I hear none. Renal arteries. And her femoral artery. Great. I'm going to go ahead again and tap on your belly. Great. Alrighty. And now I'm going to press lightly, okay? Any pain, tenderness, discomfort? And I'm going to press a little deeper, okay, Nikki? Okay. I'm just feeling for any bumps, lumps, masses. Nothing. I'm going to go ahead and feel the outer margin of your liver here. Okay. All right, feel for a femoral pulse. 2+. Wonderful. And if you would go ahead, Nikki, raise your head. Well, I'm gonna look at your belly. Raise your head for me. And no hernia, the diastasis recti there that I'm noticing. You can go ahead and pull your shirt down. So, alrighty. Any questions there? Now, while you're laying, I'll let you have your pillow bag. Being that Nikki is a female, we'd go ahead while I have her laying back and talk about her breast exam. Are you doing this monthly? Mm-hmm. Okay. So, let me grab one more pillow here. There's a smaller one, sort of. Might trade you out, Nikki. Alrighty. Here we go. So if you would just put this over your head here, I'm going to place a pillow under your back on this side. Great. So make sure you're feeling on your tail of spins, all 4 quadrants, and then also on your nipple, okay? You can do that while laying with your arm on your hip and your arm down to your side on both sides, okay? You're looking for any dimpling and feeling for any masses or anything of that sort of thing. So you can do those in the shower, while you're laying, maybe just every month after your period at the same time would be a good time to check. So do you have any questions about that? Mm-hmm. All right, wonderful. All right, you can go ahead and sit up for me. Okay. Take that. Thank you. Now if you just let your legs dangle, then go ahead and look at your lower extremities. All righty. So on her lower extremities, then feel for skin, temperature, warm. Look looking for any noticeable deviations, lumps, bumps, bruises, things of that nature. I'm gonna feel for swelling around her joints, your ankles. Then rest your feet there for me. Feel your pulses down here, dorsalis pedis, 2+, posterior tibialis, 2+, and capillary refill. Less than 2 seconds. Great. Alrighty. If Nikki were not Nikki and she were a Nick, I would go ahead and do a genitalia assessment also. Feel for the hair distribution, skin on the scrotum, on the vas, the urethra meatus, make sure location's appropriate, there's no discharge, and also show him how to do that himself at home. So just to do it in front of a mirror, again, monthly, in the shower, feeling for any lumps, bumps, anything that shouldn't be there. So anyway, show him how to do that. Do you have any questions, Nikki?
I do not.
Alrighty, thank you. So next we'll move on to our cranial nerve assessment. Alright, Nikki, now I'm going to go ahead and test your cranial nerves, okay?
Okay.
Alright, so we're going to start with number 1, olfactory nerve. If you would just close your eyes, I'm going to put a couple scents in front of you if you could identify them for me, okay?
Okay. Vanilla?
Good. It is in fact vanilla. And one more.
Cinnamon?
Cinnamon. You did that even though I punched you in your chin. Even more impressive. Good. Number 2 is your optic nerve. So if you would cover this side, I'm going to cover this side. Just tell me how many fingers I'm holding up, okay?
1.
Great.
1, 2, 3.
Wonderful. Cover there.
1, 1, 2.
Awesome. Great. Alrighty. Excuse me. Next is nerves 3, 4, and 6. Those are the oculomotor, the trochlear, and the abducens, okay? So if you just follow this, we're going to go through 6 fields of gaze. I'm going to hold your eyes laterally looking for nystagmus, okay? So just follow this, keep your face at me, and follow with your eyes. Wonderful. Great. All right, I followed in for me. Awesome. All righty. Wonderful. All right. Number 5 is the trigeminal muscle. I want you to clench your teeth for me. I'm going to palpate this temporal muscle here and the masseter. Okay, if you would go ahead and try and push your mouth open. Good. All righty. And then if you'll close your eyes. All right. Now, that is dull. That is sharp. With your eyes closed, I want you to identify those for me, okay?
Dull. Sharp. 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 Dull. Dull.
Good. Wonderful. Alrighty. Next is number 7, your facial nerve. If you would, puff out your cheeks. Wonderful. Raise your eyebrows for me. Smile and frown. Awesome. Good job. Alright. Next is auditory cranial nerve. So if you would, I'm going to hit this, place it on you, and I want you to tell me when the ringing stops, okay? So,
Okay.
All right. Close your eyes.
Okay. Okay.
Okay, so that's beautiful and
Okay.
wonderful. Alrighty. Alright. Number 9 and 10 are going to be the glossopharyngeal and the vagus. So if you would, open your mouth. Oh, you need a light for this. And open your mouth. Real wide, stick your tongue out, say ah. Uvula moves up, good. Alrighty. Alright, go ahead and swallow for me. No difficulty swallowing, and I'm gonna gag you. Okay, good job. Gag reflexes intact. Alrighty. Now, number 11, the spinal processes. I want you to shrug against me. There we go. Face this way, wonderful, and this way, awesome. And the hypoglossal, if you would, just stick your tongue out. It is midline, side to side. Wonderful, symmetrical, good job. All right, great. So those were the cranial nerves. All right, next we're gonna move on to your musculoskeletal assessment. Okay, so if you would, go ahead and stand for me. Great, so I'm just gonna kind of feel over your bony prominences here, your shoulders, iliac crest. Great. No deformities. One hip does not feel higher than the other. Alrighty, just gonna kind of feel for any crepitus. Okay, and if you would, face away from me. We'll go this way here, and just bend at your hips. Let your arms hang. I'm gonna feel here. Any deviations for scoliosis? No? All right, you can stand back up for me now. All right, wonderful. Now, if you would, just up and down and side to side. Great. You'll open your mouth. I'm feeling for TMJ, any locking, popping, crepitus, which I don't feel any. All right, wonderful. Okay. And if you would, just arms up. Or here, both of them at the same time is fine. And you push down. And pull up, wonderful. I'm just gonna kind of feel your joints here. Again, feeling for any locking, popping, crepitus, anything that shouldn't be there. Squeeze my hands, great. Go ahead and try and spread your fingers for me there. Awesome, okay. And then go ahead and sit back up on there. All right, so I'm not noticing any swelling, any warmth, any redness. No crepitus, like I said, on the upper extremities, same on this lower. I'm just feeling for swelling, popping, locking, redness, warmth on all of her joints here. Okay. All right, so go push up, push down, and then with your feet like you're driving a car. Awesome. All righty. Now I'm going to start your cerebellar and sensory examination. So you're going to stand up for me. If you would, if I could just have you walk in that direction. Let me watch you. Great. Go ahead and turn back. All right, one more time. Go ahead and do heel toe that way for me if you would. Wonderful. And back. Just while I have you up and moving. Great. If you can stop. Okay. Yeah, if you would. Do what's called a Romberg test here. Okay. Just close your eyes, hands to your side here. Make sure you're not swaying. Your balance is good. All right, great. All right, now, if you would, just hop on one foot for me. All right, now the other one, that's fine. Great, all righty. And can you do your heel motion? Great. Wonderful, awesome. All right, you would just put your fingers. Great, and then if you would touch my finger and touch your nose. All right, awesome. You can have a seat again. Okay. Now, you would just close your eyes. And much like we did before, I'm gonna do a sensation test again, okay? So I'm gonna tell you that this is sharp, okay? That's dull. All right, so you just tell me what you're feeling, okay?
Sharp, dull, sharp, dull, sharp, dull, sharp, dull.
Great, good job. Alrighty. Now, going to this tuning fork, put it on your hands. I want you to close your eyes. And I want you to tell me when you feel it stop, okay?
Stop. Okay. Stop.
Okay. And feel and cross your legs for me. Same thing.
Stopped.
Try that again. Okay, close your eyes for me.
Stop.
There you go. And one more time.
Stopped.
All right, good job. All right. All right. And again, we're gonna do sharp double on your lower shins. So you close your eyes one more time.
Okay.
So sharp and light. Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Wonderful. Alrighty. Okay. So if you'll close your eyes again, I'm gonna place an object in your hand, Nikki. I want you to tell me what it is, okay?
That feels like a pen.
Great. Alright. Good job. And again, close your eyes.
Q-tip.
Good. And then I'm gonna draw a number on your hand. And I want you to tell me what it is, okay?
Okay. 2.
Why don't we try a letter? Okay. Alright, let's try a letter.
Okay.
Eyes closed.
Yep. C.
Great, there we go. Good job.
Oh my goodness.
Alrighty. And try another letter.
Okay.
Mm,
V.
different letter.
A.
There we go. Okay, good job. Alrighty. And then next I'm going to check your reflexes here, okay?
Okay.
So if you'll just kind of rest your arms out for me. Okay. Try that one here. Alrighty. And we'll do. Okay, sure. Kind of rest dangle your arm for me. Try that one more time. There we go. And this one. Just rest dangle your arm for me. Okay. Toe in here. Just that. There we go. Okay. Okay. And your Achilles. Alrighty. So that was your radial, your brachial, tricep, patellar, and Achilles reflexes. Now if you would, just gonna listen. Check for the Binsby. It's curved in, which is a normal result. All right, Nikki. I think that gets us started. We're done. Do you have any questions about today?
I do not.
Alrighty. Well, thank you so much for letting me do your head to toe assessment.
Thank you.
All
Good
right.
luck at school.
Thank you.